everyone, these are anatomy and physiology videos for healthcare students. In this video, we're going to discuss long bone anatomy. So at the left, I'm going to run through this list of terms with you. So why don't we start with the very first one, which is the shaft or the diaphysis. So when we talk about long bones, we're talking about arm and leg bones. You could include fingers and toes in there as well. And instead of talking about the very detailed parts like, the deltoid tuberosity or the linea aspera, we can be very generic. And the term diaphysis means the shaft of any long bone. So you'll notice in looking at the shaft, the inside is hollow. There's a cavity in there. We'll talk about it in just a moment. And on the outside, there is a very tough, strong bone called compact bone. Now, the epiphyses or epiphysis is found on the ends of the bones. So each end of the bone has its own epiphysis. Let's go back and use some directional terms. So the portion of the bone that's closer to the point of attachment to your body is called the proximal epiphysis. The one farther from your point of attachment is your distal epiphysis. So together, these epiphyses are the ends of your bones. If you take a look at the inside here on the pictures, it looks like some spongy bone is common in the ends. They call it cancellous substance in this picture, but it's spongy bone. You'll also notice there is a growth plate on either end of the bone in the epiphysis. Our long bones grow from growth plates or epiphyseal plates found in the epiphyses. This medullary cavity or marrow cavity inside the bone stores bone marrow. It's a modified kind of connective tissue that is important for making blood cells through a process called hematopoiesis. Red, white cells are made here as well as platelets. So how did this hollow cavity get there in the first place? It has to do with the way the bone is growing during your childhood years, and it deals with the epiphyseal plate. As the growth plate pushes further and longer, dead cartilage cells are left inside that are digested by lysosomes and through bone remodeling. So we end up getting this hollow cavity, but we don't waste that space. That's, of course, for bone marrow, red marrow in most cases, yellow marrow in some. Let's talk about coverings on the outside of the bone. So around your epiphyses, where your bones articulate or create joints with other bones, there is a layer of articular cartilage. You may have already learned all about your cartilages, such as hyaline, elastic, and fibrocartilage. So we're not saying this is any one of those particular types. We're simply calling it articular because it's found in a joint. So bones joint together here at these end regions, and this cartilage helps to reduce friction between the joints. You'll notice in this picture, it kind of has a shiny white appearance to it. You may have seen this on chicken legs before. If you've eaten chicken wings, chicken legs, you'll notice that cartilage, sometimes called gristle, that covers the ends of those bones, all about reducing friction as those joints articulate or move past one another. So we don't need articular cartilage along the diaphysis or shaft. There we have a very tough kind of connective tissue called periosteum. It is anchored to the underlying bone tissue with a type of fiber called a Sharpie's fiber. And if you've ever walked in a parking lot on a hot summer day and had the misfortune of stepping on recently spit out chewing gum, you know how you pull your foot up from the ground and you see all these strings of chewing gum come with your shoe? That's kind of how these Sharpie's fibers anchor into the underlying bone tissue. That periosteum is not meant to separate from underlying bone. In fact, if you think about tendons or ligaments that grow into that periosteum, we don't want that to be able to separate when we lift the heavy object. So that periosteum and anything that anchors through it must stay anchored to the underlying diaphysis or bone tissue. Since we were just talking about periosteum, let's take another look. You can see it covers the outer surface of the diaphysis. By contrast, the articular cartilage covers the outer surface of the epiphysis. While we are here, just take a moment to appreciate that medullary cavity, and there's some bone marrow in there as well. So that medullary cavity is also lined with a very thin layer of simple squamous epithelium. It is called endosteum. So this is a great time for us to have a conversation about those prefixes and word roots. Ost, O-S-T-E, means bone. Periosteum means around the bone. Here, endosteum means within or inside the bone. Always use those helpful clues built into these words. Let's talk about the epiphyseal plate. So, as a growing child, we have epiphyseal plates located in the epiphyses, or the ends of our bones. In these three pictures, that blue line that has a white arrow pointing at it, that is the epiphyseal plate. It's actually a region of hyaline cartilage that grows and divides, pushing the bone longer. So you do have one on both your proximal epiphysis and your distal epiphysis during your growing years. Really cool picture here of an x-ray. You're looking at the tibia and fibula. In fact, you're looking at the distal end where the tibia and fibula create our ankle. So if you look at the tibia and fibula, it looks almost like there's a fracture through there, but that's not a fracture. That's actually the epiphyseal plate. It's just a dark space through the end of the bone. There's hyaline cartilage in that dark space. Let me circle them for you. Let's take another look at tibia, fibula, and now the femur. You're looking at the knee joint this time. And so again, let me circle those epiphyseal plates so you can see that they're in the epiphyses or ends of the bones. So in fact, that epiphyseal plate creates an additional joint that when you talk about articulations or joints in your anatomy and phys course, this will be one of the conversations you have. Pretty cool advancement from a child's bone growth, grade 0 to grade 5 here. Just look at those epiphyseal plates at the distal end of tibia and fibula. They look like distinctive bones in the top left picture. By the time you reach the bottom right, they will have fused together because as bones grow, they eventually get to the point where they've accomplished their job and no more lengthwise growth or longitudinal growth is needed. So by the time we reach our mid-teenage years, girls and boys reach this point a little differently. We will have come to a point where our bones no longer elongate. So at that point, a layer of bone-forming cells called osteoblast will have caught up with the layer of hyaline cartilage and ossified it, meaning it's been turned into bone. So we no longer can have bone growth in length after that point in life. What we're left with, however, is a remnant of what was once bone growth. It's called an epiphyseal line. So this transition may take years to complete. Usually by around age 25, the complete transition from plate to line has been accomplished. So after that transition point, there's no more chance for elongation or longitudinal growth in a long bone. Well, thanks for watching my video. If you have any questions, you're welcome to leave them in the comments. If you like the video, please follow my channel. Thanks for watching.